we will be going over each column of a dosimetry report, so I will grab it right here. We'll go over each column. So these are the employee names that work here. This is the wear period. This is your dosimeter type and location to wear, and your wear period, so from April to July of this year. Body dose, and it measures your current dose, your dose this year, and your lifetime dose, all which are measured in millirems. The places where you see ND means it's not detectable, and where there are numbers is your dose in millirems. It also gives you a reading for deep dose, eye dose, and shallow dose for each one. I'm on the very bottom here, so I can read all the way here, and these numbers are well within the range that is acceptable for your dose of millirems. Okay, now I will be explaining why it is unsafe to be exposed to a primary beam when taking radiographs. The damage that is done to you is directly correlated to how far away you are from the beam. So the primary beam is what you don't want to be exposed to. It can cause both somatic and genetic damage, but exposure from the primary beam onto your skin can actually cause severe burns. It starts with reddening of the skin, and then can, from there, lead to further injuries or permanent damage. Okay, now I will be demonstrating how to put on your PPE, or your personal protective equipment. I will be demonstrating how to put on your lead gown, thyroid collar, gloves, and dosimetry badge. We'll start with the gown. This is an example of the lead gown that we wear here, and it's important to inspect each piece of your PPE before you put it on. That way, if there are any tears, you know about them, so that you're not being exposed to radiation without knowing about it. This is the gown. This is the thyroid collar. This is my badge. Inspecting my gloves before I put them on. Now I'm ready to take x-rays. Our clinic does not have the protective eyewear to demonstrate, but I know that when I will be taking my x-rays, I will be looking away from the primary beam and protecting my eyes that way. Okay, now I will be demonstrating how to pull up a patient on our software, which is ClientTrax, which will then order up our x-rays to the radiology suite so that we can take x-rays. So I'm going to take you with me. We're gonna go sign in to our software. This is ClientTrax. And I'm going to type in the last name of our patient. And I'm going to pull up their patient card, go into their medical record, and go into our treatment area, which is where we put in our charges. I will type in our charge for x-rays, which is Survey Radiology 3-View, or 3-Film, and it'll pop up this window. So once I hit enter on this window, it will then send the x-rays over to the radiology desktop. It also turns this image button green with a green check saying that my x-rays have arrived. So I can go over to that desktop. And hit my register study button up here, hit work list, and then hit today. And there's my patient, so I can double click on her. And now I'm ready to shoot my x-rays. Okay, now I will be explaining how we obtain our settings for our machine. We do not have a technique chart, but we have a rule of thumb of what settings we need to obtain according to the size of the patient and what film we are trying to get. So in just a second I'll show you the machine, but we are able to adjust our KVP, which is kilovolts, and P means peak, so peak of kilovolts, and then our MAS, or our milliamperes per second. I'll show you how you can adjust those in just a second, but general rule of thumb is if your KVP is too low, then your image will turn out whitewashed, and if it's too high, then it'll come out too dark. But there's different settings depending on if you are taking x-rays of the skeletal system, the abdomen, or the thorax. So let me show you here. On our machine, up at the very top, you have your KVP, your kilovolts, your milliamperes per second, so 400 per 0.01 seconds, which gives us our MAS, or milliamperes per second, which is 4. So depending on what you're taking x-rays of, if you are taking an x-ray of bones or soft tissue, then you will want a higher KVP, you'd want a lower KVP, 60 or 70, so that would be appropriate. And your MAS, you would want to have higher, like a 10 to 15. That way you can distinguish the bony details. If you wanted to do the thorax, it would be the complete opposite, and you would have a KVP higher, and you can adjust here to like 80 to 100. And then you would want to adjust your MAS to be lower, and so that would be like a 3. A 4 might still work. But that way you can penetrate through the blood vessels, and you can distinguish organs that way. And then the abdomen is just a good medium of both, and that way you get good pictures. But that's how you adjust it, is you use those knobs there, and then you're able to select, lateral VD of your patient. Okay, now I will be demonstrating how to search for a patient on our x-ray desktop to then pull up x-rays taken from whenever. So I will be searching for a patient named Jack, and I will show you how to do this now on my desktop. So if we are searching for a patient, we don't want to be in exposure, because that means we're taking an x-ray. We want to go into our database, and here's your search engine. So I know that Jack, we took his x-rays on November 11th, so I'm going to go back in time, and I'm going to select the date that I know I'm looking for. You can also look through the patient's name, ID, sex, any of those things, but the thing that I know off the top of my head is that we took the x-rays on the 11th, so I'll hit search, and it pulls down all of the x-rays that we've taken from the 11th until today. But if I look down here on our date, here's Jack's x-rays, so I can double click on him, and it pulls up his x-rays down here that I can then select and view individually. Okay, now I will be going over beam centering. For the radius ulna shot, you want the beam to be centered at the mid shaft of the radius and ulna. For the VD thorax, you want the beam to be centered at the caudal border of the scapula, centered at the midline. And for the OFA pelvic shot, you want the beam to be centered at the midline between the left and right ischial turbosities. Okay, now we will be going over steps for a barium contrast study or a barium swallow. The steps to do this is to first give your barium. You can mix barium and food and let them eat it, or you can give it directly by mouth through a syringe. Usually you want to give just a cc at a time, and you can either give it straight to them, or you can put it in their cheek pouch and let them swallow it on their own time. But make sure to leave some time, allow some time for them to breathe in between each swallow, that way they don't inhale some on accident. And then once you get all barium down, which it's 6 mils per kg or 12 megs per kg, anywhere in between there for their body weight. Once you get all of the barium in, you immediately take your first shots, which would be 2 laterals and a VD typically. And then depending on your doctor's recommendations, you take continuous shots, 30 minutes, 45 minutes, or an hour from your last one. That way you can watch the barium slowly move through the gastrointestinal tract and make sure that it moves all the way through and it doesn't bundle up on something, which would indicate an obstruction.